Hello, my name is Lisa Bontemps and I'm the program manager for Westwood for All Ages. I'm going to be sharing with you the results from a survey that many of our older residents here in Westwood completed during the months of May and June. Our intent with this survey was to see what kind of an impact COVID-19 has been having on various aspects of the life of the older resident here in Westwood, New Jersey. We knew that when the pandemic happened and people were having to self-quarantine, that the demographic hardest hit by this is the older population because of the associated health risks with COVID-19, should they be contracting it. So we anticipated that there were several things that might negatively impact older residents and wanted to reach out to some of them and see if that was in fact happening and how they were dealing with this pandemic. So just to kind of share with you some information that we collected, you'll see that we had 131 responses, which is a pretty good response rate given that here in Westwood, it's anticipated that we have about 1,100 or so people over the age of 65. So it's a little over 10%. One of the questions we wanted to know was, how has this pandemic impacted people's lives since it happened in mid-March? And not surprisingly, a fair number, you'll see here 69 or 60% show a somewhat negative impact. 18% said it had an extremely negative impact, and there's only a small number there, ranging from 6.15 to 10%, who showed that it didn't have much of an impact or a negligible one. So this is not a surprising result, but we did want to have sort of a gauge to see what their perceptions were on how it impacted their life overall. And in terms of challenges, the interesting thing here is that the challenges that they faced that were the largest ones is just having that social connection, the isolation. 76%, fully more than 3/4 of the population told us that one of their biggest challenges during this time is just staying in touch with others and having that social connection. We know that it probably is a very lonely place to be if you're isolated at home and it's just you and a spouse or just by yourself. Secondly, groceries and food shopping. Initially, when the pandemic hit and there were shortages in the stores and there were challenges in terms of how to set up shopping for people so that it could be done in an orderly way, even before masks were recommended. Many of the seniors found it was very difficult to get certain food items and to go shopping, and that's when several of the food pantries, and here at Westwood for All Ages, we were instrumental in this as well, went to work on creating some emergency food pantries and delivering food to people and setting up volunteers to make grocery runs for seniors. But it was a little less than half, which is still a good size number, 44% who said that that was a problem for them. As the weeks go on, we're finding this to be less of a concern, however. And then just seeing physicians and having other kinds of health appointments, those had to be put off or were being done by telehealth. And so that was impacting a little under half of the respondents. So one of the things we also wanted to know was, how is this impacting them from a psychosocial standpoint? So looking at where people's mood was currently at the time of filling this out during the pandemic, roughly a third, a little over a third, said that they were neither gloomy nor feeling terribly optimistic, but feeling right in the middle. And in speaking anecdotally with many of our seniors, the answer we got a lot was, I have my good days and I have my bad days, which is something that sort of reflects that being in the middle. And some of that may be dependent on some of those factors related to their health and social connections. Taking a look at how their mood might have compared to what it was like before the pandemic hit, you can see that fully half said that it's worse, a little bit worse, not terribly, terribly much worse, but definitely not as good as it used to be. And again, that's something that we would sort of expect, that people might have good days and bad days, but overall their mood is not as great. In terms of physical health, it looks like most people, over half, feel that their physical health is very good or pretty good to excellent. Very few people were saying that their health was poor. In fact, nobody said that their health was very poor. And there's a few that have some issues, but they're dealing with it. So this was an encouraging result, that their health is, under the circumstances, doing quite well. And this question takes a look at how did it change since the pandemic. And you can see that for the most part, as a significant number, 82%, their health is about the same. So it hasn't gotten better, it hasn't gotten worse, it stayed the same. And of course, if they're sheltering inside, that's probably why. The next slide takes a look at how people are dealing with the stressors of the pandemic, and really all from whatever sources that might be coming from. And as you can see from this graph, 41% are sort of right in the middle there, that they're feeling neither stressed nor relaxed. But notice that the numbers that are higher than that, where they feel a lot of stress, and somewhere in between, a lot and some, are still quite significant. Only about 40% total are only about 17 or 18% are feeling no stress at all, or very little stress. So not surprisingly, this has been a stressful pandemic for many people, and it's affecting our elderly residents as well. Looking at how it is now as compared to before the pandemic and before the social distancing happened, more than half say that they are somewhat more stressed, and some even more are saying that they are very stressed. So it's definitely on this higher end of the stress continuum than the lower numbers of not feeling any stress or being less stressed. We really wouldn't expect somebody to be less stressed now as compared to before the pandemic, barring any unusual circumstances. So this is a rather consistent result with what we might expect, but concerning because it is rather high. Also looking at physical health and physical activity, we asked the question of have they been able to exercise during this pandemic of social distancing? And many people are saying yes, that they are, but a good number of them can't do as much as usual. And we assume that that's because they might be used to going to exercise classes, whether at the recreation center or the Riley Center or at gyms, or maybe they like to get out and do exercise that they haven't felt comfortable doing during the quarantine. Some were reporting that they are doing about the same. About a quarter of people are exercising the same amount as usual. And of course, there are a number of people, we have about a little over 11% who weren't exercising to begin with, so there hasn't been much change for them. Getting back to this issue of social connection, we wanted to know how much people are engaging in conversations, whether they're in person with loved ones or friends, or on the phone, or perhaps through video call like FaceTime or Zoom. And you can see here that it's rather spread out. So there isn't any one indicator here that is that much higher than the others. Just about a third of people are spending about an hour a day or more, which is that 7+ hours a week, in some kind of contact with people. And only a few said that they spend less than an hour a week in conversation, meaning that they really are very, very isolated. And then in terms of looking at how connected people are to various social media, we gave them some examples like Facebook, Instagram, Twitter, Pinterest, YouTube. And it looks like about a third of people are spending a considerable amount of time on social media. About a third of them are spending more than 7 hours a week, which again is about 1 hour a day. And this is rather encouraging because social media has been a good way to reach people and for people to sort of stay connected with what's going on in the world. And we'll probably want to drill down a little deeper on this as we look forward to some of the plans that we have in place at Westwood for all ages of how we can provide better access for people to be online and learn about and utilize some of these different forums for connection. One of the things that we're very interested too in knowing is what were those sorts of things that people maybe want to be doing while they're at home and staying in sheltered in place, but they feel like they're not able to. Some things they can do online if they have the means to do that or the knowledge to do that, and some things they may not be able to. So interestingly, 45% want to be able to use library services online and either didn't know how to or didn't have access to that in some way. I will just say at the outset that you might be wondering if the people who were filling out this survey were doing it all online or if they were doing it by paper and pen. And the answer to that is both. So we had a number of surveys that were left at the Westwood house and various apartment buildings where we know seniors live. And we had a good number, close to 30 to 40, that were returned that way. And then the rest were done online. So that you see some people are online while other people are not. So attending exercise classes online is another thing that people would like to be able to do and haven't been able to. And again, maybe it's just access or knowing how to do that. And then down at the bottom, we had some others where people were able to write in some things that they wanted to do. I think this might be a function of the word, of the question perhaps not being word as well as it could have, that we got some of these answers like visiting friends at home. Well, that's not something that you can really do online except through something like Zoom. Outdoor group exercise classes, again, I think they were thinking that this was something that they just wanted to be able to do and couldn't do. And then what are they looking forward to the most when things begin to return to normal? And we put that in quotation marks because we're not even quite sure what normal is going to look like. But nonetheless, we wanted to know what are the things that people are really missing. And as you can see here, again, so much of what we're seeing in this survey points to social connection. So eating in a restaurant, 84% of our participants said that they would love to be able to eat in a restaurant again. And this survey came out when many of the restaurants were not even offering outdoor dining, let alone indoor dining. So these answers are primarily based in that context where people would have had to order takeout. So just being able to eat out, and again, presumably with others so that they could have that social connection meant a lot to them. Gathering with friends at parties and having family gatherings, all of those are really high. But also there was a fair number of people who said they wanted to go to planned group activities. So that might be things with social clubs that they might belong to. You know, going to museums, going on bus trips, that sort of thing. And then a fair number of people also wanted to attend religious services. And that's something that many of the churches, in fact, I believe most, if not all of the churches in Westwood during this time have been offering their services online. But again, for those seniors who are not connected to the internet, that has not been a good option for them. As things begin to reopen, we wanted to know how confident they would be in returning to some of their activities. So you can see here we have a table that sort of shows you what the weighted average on a scale of 1 to 5 of everything is, where 5 is the highest, where they'd be very confident, and 1 would be not at all. And if you look on the weighted average for most of these, they're kind of in the middle. But what we see is some of the things that they're the least confident about is doing any kind of recreation programs indoors or outdoors for that matter. They feel quite confident, I think, with returning to houses of worship and some of the outdoor community events. But where we saw the highest and the lowest, that's why we have little smiley faces and the sad faces, is people feeling the most confident going back to grocery shopping and doing other types of shopping as stores open. And that's good because just getting out, even if it's to a grocery shop, means you're able to not isolate so much and people are feeling a little bit more independent and confident navigating. And the stores have done a great job of creating a structure for people to be able to social distance while they're doing their grocery shopping and requiring masks. The things that you will see our older residents not feeling confident to do right away is transportation, whether it is flying on an airplane for a vacation or taking any forms of public transportation like a bus or a train. Some of this might be just related to that sense that it might not be social distanced enough, or that there may be a perception that it's not clean enough, that they're more susceptible to germs if people are not wearing masks on the buses and the trains. And, you know, I will say that New Jersey Transit and other providers have been doing a very good job at trying to create a very clean and safe environment for travel. And so perhaps there might need to be some work on education in this area to help people feel a little bit more comfortable taking public transportation. The greatest concerns about things opening up again are, not surprisingly, the cases of coronaviruses going up again, that dreaded second wave that may be anticipated, and what that might mean. Older residents are very much aware that they are the highest risk group for death of this pandemic. And so there's always this lingering fear that it could come back better and stronger and more virulent. And so that definitely is showing up in this. And then the other thing is people not following social distance or mask recommendations. And even though there are recommendations in place and mandates in certain places to wear masks and to be mindful of social distance, it's not always complied with. And people obviously are concerned that as time goes on, people may become less compliant with that. And then, of course, just catching the virus itself from any number of ways is another legitimate concern that many people have. The last thing that we did was just some demographics because we wanted to get a sense of who was actually completing this to see that it was in the right group. There were only a few people under the age of 40 who completed that. We didn't filter those responses out, but it was a small number. You can see the largest group, which is the group that most of us are dealing with right now at Westwood for All Ages for some of our programs, is 70 to 79. But you can see it covers the full span. We did not have anybody over the age of 95 filling it out, however. And primarily white or Caucasian, and percentage-wise, this is a little bit of an over-representation of what Westwood looks like. Mostly female, and again, not surprising, there are more females alive in Westwood in that age cohort, so we would sort of expect that to be the case. And nearly all of the respondents are from Westwood. Again, we did not filter that out, so there were a few from other municipalities. Most people own their own homes, with about a little over a third being renters. Again, we did get a lot of people from the Westwood house and some of the apartments around town who completed this as well, and that accounts for most of those. And then in terms of looking at our relationship status, most people are married, but we did have some that report being widowed or divorced. And this last slide just shows you what some of the livability domains and community responses are to COVID-19. Westwood is a member of the AARP Network of Livable Communities. And one of the things that AARP and the World Health Organization have done is identify 8 domains of livability that show how a community, whether it's a state or a town or even a country, can be more age-friendly. Since the pandemic, however, they've modified those domains so that they're more specific to the COVID crisis. So looking at social participation, for instance, this was one of the areas that we saw in the survey, the social isolation, the loneliness, that was a big concern for our residents. So some of the things that they've recommended and things that we do here in town is to start a daily community-wide appreciation clap for healthcare workers and first responders. That's something that was done at our local hospital for a number of weeks. Drive-in theater, that's something that is actually in the works through Celebrate Westwood right now and our Westwood Ambulance Corps, so you'll be hearing more about that. host a dragging Main event so residents can get out and see other people by driving slowly along their community's main roadway. Interesting idea. Asking local entertainers to perform online or outside of their homes. So we have had here with Westwood for All Ages a number of what we call social connection happy hours, and we've been doing them on Zoom once a month. And in these meetings, we've provided some entertainment from local performers. We've also provided information on things happening in Westwood. We've had tips on health and wellness. We've had cooking demonstrations, all with the idea of getting people together online and sharing information and seeing each other and having a little bit of a break from day-to-day life. So you can always look at these domains here. They are on our website, westwoodforallages.org. They're in our most recent newsletter that is coming out this week that will be distributed at the Westwood House and also online. And if you have any questions about any of this information, you can always reach out to us at www.allages@gmail.com. Thank you for your time and attention to this presentation.